Our next presenter is Dr. Rahul Khare. Dr. Khare is the founder of Innovative Express Care. He was an emergency physician at Northwestern Memorial Hospital for the last 10 years. He was an associate professor at Northwestern University. He completed his master's degree in science in clinical investigation from Northwestern University and did his emergency medicine residency at the University of Michigan. Innovative Express Care has primary care, urgent care, pediatric care, but they also have a branch dedicated exclusively to medical cannabis. Not only do they perform medical cannabis evaluations, but they accept insurance for those appointments. Innovative Express Care also has a subspecialty clinic where they are able to counsel patients to advise them on proper forms and strains of cannabis that will best suit their conditions. That would have saved me a lot of time and money when I first entered the cannabis industry. Please welcome Dr. Khare.
Can I? Okay. Hi guys, I'm Dr. Khare. It's nice to meet you. I've been told that we're going to hold questions till the end, so just write them down. I'm also very accessible, so that email address that's on the screen is my email address. So please use it. It goes directly to me. I enjoy answering these questions, any questions that you have. I'm gonna go through a little bit of what we do, my story, Innovative Express Care story, couple cases or cases that come up repetitively on patients on opiate medications, patients on benzos, and how we can use opiates to really help them. So I'm not going to go over a lot of the benefits of cannabis. You guys have heard so much about it. Interesting stuff that I've realized that cannabis helps with. There are a lot of studies on cannabis, as you guys know, but there aren't excellent studies out there. And so a lot of what I'm going to talk about are anecdotal observations. We've certified over 3,000 patients. And I think that we have a good knowledge about what it can do. Some things that have been really interesting to me on things that it could treat that I had no idea how well it could treat was something like Tourette's syndrome. Tourette's is a syndrome, not an actual disease, but it's one that is very prevalent and very misunderstood. And most of the patients that have Tourette's that are adults are already self-medicating because they try it and it calms down their motor tics and their OCD tendencies. And cannabis does that so very well that I almost think it's a first-line treatment in Tourette's and really push to have as many patients on it as possible to help them, if they're in school to go to school, be able to go and to socialize. So that's one of the interesting things, but I could go on and on about it. One of the biggest questions I get are from my colleagues, and I wanted to talk about demystifying cannabis with my colleagues, physicians in particular, clinicians, people who are in the healthcare field that should be advocating for cannabis, but have the myths that are around it, So a lot of them I talk to about it's side effects. Like there are side effects to cannabis. Somnolence is one of them. We can control the THC that's involved in the cannabis that you take, that you ingest, either orally or smoking it, or patches. And there are ways to definitely decrease the somnolence, but if you get a significant amount of THC in your system, it does increase your somnolence. And that's why it's so good for insomnia. And then paranoia. A lot of people talk about that. I took it once. When I tried it in college, and it was awful. I said I'd never use it again. And there's no question that they did get paranoid. They did get that effect. But we're learning now that it's strain and dose dependent. You can really, when you first start cannabis, you can really make sure they don't get this pretty bad side effect by by limiting the amount that they get, by getting a strain that doesn't that causes relaxation instead of paranoia. But if they take too much, ultimately they can get paranoid and bad things can happen. So that's something that I try to talk to clinicians about. And then we've been taught a lot to not like cannabis, like physicians and clinicians in particular. Until 3 years ago, we were told it's illegal and every patient that's on it should get off of it. And so this has been, if you're a 60-year-old physician, you've been told your whole life that it should not be used. So I don't blame my colleagues or clinicians about not, or being skeptical about cannabis. But the education that we have in this room to the healthcare profession is very important to try to talk to them. Because we all know that it's not dangerous. There's no overdose deaths that they know of. There are some case studies where someone did take it and jumped out a window and died. But again, that's a little bit different, and we have to be careful of people that do tell us how dangerous it is, because the truth is it's not. This study that has gotten a lot of significant press, I think is a wonderful study, and basically they found that in places that have legalized or have become medical, that there have been a significant amount of decreased opiate prescriptions given. And it's an observational study, it's a large, they're not telling you why, they're not telling you exactly, but we all know, not much has changed in the opiate world in the last 5 years. And it's very fascinating to see a huge drop in these prescriptions, and that's a good thing. I really believe it's a good thing. We haven't studied the quality of life on these patients, but anecdotally I can tell you that patients on cannabis that are off their or decrease their opiates are significantly happier. And one of the last speakers we had told a phenomenal story of this, getting her morphine pump out, her stimulator out, all of that stuff is just the amount of weight she lost when that happens, her digestive system, we're coming back, and she's leading a healthy life now and in remission. And can that story itself, I've heard 100 times, and I love it. I can't get enough of it. So we need more of those stories out there. So about the opiate crisis, it's real. We have been and currently treat chronic pain with opiates. I think it's getting better. I think physicians are almost swinging the other way now to not give opiates in cases where patients have been on it for 10, 20 years, and it's causing significant havoc in their lives. Because of this, Innovative Express Care did open up a pain management clinic, and I really think that this new pain management with cannabis needs to be replicated and done all over the country. We're not there yet. We're trying it the best we can. We're still recruiting patients. Believe it or not, patients aren't coming to us because they're afraid they won't be able to get the medications from the opiate medications that they need. And so we've had a difficult time of recruiting patients, but we're getting them, and we're having tremendous success so far. The current way of treating chronic pain is not very good. Everyone who has it has tried gabapentin or Neurontin, Cymbalta, Tramadol. All these medications have pretty severe side effects. And unfortunately, and this is statistical, they rarely work. If placebo is about 3%, these medications can work up to 5 to 6%, which is double the placebo. But imagine 100 patients and only 5 of them will get helped. So I'm not against these medications. I've actually prescribed them before, but I definitely don't think they're the solution. And until recently, there's only limited treatment options for their pain, and cannabis has really helped that. So a little bit about Innovative Express Care and myself. I worked at Northwestern for 12 years. I got research grants from the NIH to really study how people got health care in this country, and especially in Illinois. And I was up for my next grant. Funding was pretty hard. And I kind of looked at my chairman and I said, I kind of want to be doing healthcare instead of studying it. And he agreed. He said, you should probably get a small business loan instead of a grant and try to open up your own center. So 3 years ago, we opened as an urgent care, expanded as a primary care, expanded medical cannabis certification. We have 3 therapists now, 2 of them which are here, who do mental health therapy. We've brought on Farah, who's sitting up front, who helps with cannabis consultation, which has been helpful with me and my patients to help get them the right strains. And then we opened up pain management recently. So we're trying to expand on where we feel the most need is for our patients. We take insurance 100% if we take it. We take all major PPOs, we take Medicare so people on disabilities, anyone over 65. So we really welcome that. You should use your insurance to get certified, and we really believe in that. I started because our clinic, first of all, sees about 95 patients a day, 7 days a week. That's our average. Just to be clear, less than 5% of our patients are medical cannabis patients. This is not what we do, only what we do. We are a general practice. We practice medicine, but believe in cannabis and have opened our doors to it. But that's not all we do. When cannabis becomes legalized for recreational, we'll still be around. We want to be there for the healthcare for those patients with their cards, or for those patients that are using cannabis for chronic pain, or who don't use cannabis. We don't really. We just are pro-cannabis, and I just want to make sure everyone knows that, because I think we are getting tied into we're cannabis only, but we're healthcare. But we really, truly, everyone in our office believes in cannabis. They wouldn't work there if they didn't. And the way I got started on cannabis certification is that, a couple of my patients came to me and said, there's this new law. I use cannabis, it helps me, but I can't get the right cannabis, I can't get the right strains. I've been to Colorado, I've been to California, and my pain was virtually gone there. I said, well, this sounds too good to be true, but what do I have to do? They gave me the paper, they educated me. And I said, I'll sign for it. And then I started following these patients, and amazing things started happening. They decreased their flare-ups. They started decreasing their opiates. I started writing for less pain medications. I've never done that before for chronic pain patients. And they started telling me that their family members can't get certified by their doctor because the doctor did not feel comfortable. So I started certifying them. And then I said, let's just open it up, because so many doctors are hesitant. Why, this is so helpful. What are we doing? So they brought over the paperwork. I read it over. I signed it. We weaned down people from Norcos. Some are still on them. Some of them we weaned off of. I learned a lot about the vape pens, the tinctures, the creams. And this one patient in particular was so happy. I'll never forget it. And she would always bring her friends, and she did well for over a year. And I actually just see her only yearly now, when I used to see her 12 times a year. So, and I'm proud of her, and she really opened my eyes. So this is the start of how I became a cannabis advocate. Couple things I want to just talk about, and I give this talk to physicians, but I think it's just as important to give to people who have their card and who don't have their card. Unlike most things in medicine, this is a law. So in medicine, when I practice, I follow a standard of care. That's all I have to do. And if I deviate from that standard of care, there is a chance that I get sued, or and repercussions occur. But with cannabis, there is an actual law that you must follow. And this is very different for doctors. It's one of the reasons they don't certify or don't feel comfortable certifying. It's because there's this law that is, it's a very well-written law. It's very easy to interpret for the most part, but it's something that we don't usually have to deal with. But they make sure that there's a relationship with the physician. So asking my lawyers, what does a relationship mean? They said, well, there has to be at least 2 visits. And I said, that's fair. I think that, and so we do have that requirement. Now, that being said, one of the laws is the certifying visit must be done in person. They really did not want someone on the computer doing all these certifications. So they made that as part of the law. So the first visit with us, we do in person. The second, and to develop the relationship, we do via telemedicine. The third thing that we're citing for is that the patient must have the condition. The state never sees your medical records. They don't have access to that. But they do have access, they are able to audit physicians. So physicians must have the medical records to certify patients. So, only MDs and DOs can certify in Illinois. So that's important to know as well. So when you see us at Innovative, we make sure you have the condition. And if you don't, and you feel like you have PTSD or post-concussive syndrome, we do have clinicians who can evaluate you and diagnose you with those conditions, so then you can then get certified. So we help with that as well. So those are the three things that a physician is signing, and that's it. They're not signing that they endorse cannabis. They're not signing that they want you to be on it. They're just signing that you have the condition, you're a patient of theirs, and you've seen them in person. And I think that's important to know. People ask me, how do you take insurance? It's federally illegal. Well, when you come to our office, we do full vital signs. We take a history of present illness. We examine you. We also educate on cannabis, but we also talk about your disease process. So it could be spinal cord disease. It could be fibromyalgia. We ask what medications you're taking. We get your allergies. And so when I submit to insurance, I put down the diagnosis, fibromyalgia, and we submit it. We don't submit anything about marijuana. We don't need to. The regular way we submit to insurance is just put the diagnosis and do a good exam and talk to the patient. So that's how we can take it. People ask me, why don't other physicians take it? You should ask them. I think there's a little fear. I also think that, you can make more money if you got $200 per patient cash, right? So there's financial incentives to not take insurance. But for me, if it's November and they haven't had the flu shot, we ask them, would you like the flu shot? Are your vaccines up to date? We treat them as patients. We're not just a cannabis clinic. So I think that's one difference of what we do. This is for the clinicians out there. We bill at a 99205 or 99215. These are codes. We get paid for whatever insurance wants to pay for these codes. We follow-up visit. We do another code as well. But we also talk to them while they're in the waiting room. Farah especially talk to them about, what are edibles? What is vape? What is the flower, the creams? When can you use it? What's CBD? What's THC? So that education is extremely important, and we discuss that as well. All our visits that are second visits for the most part are done via telemedicine. A lot of people have severe disabilities that come and see us. A lot of them are in wheelchairs. It's not fair to keep them coming back to the office. So we do it from their home or from their work. We use a vendor called Khare Health, HIPAA compliant telemedicine, very similar to Skype, easy to use, and it integrates with our electronic health record. We give the health record, access to the health records to every patient. I think that's very important, that they get their chart, that they can give to their primary if they want to. We don't call primaries of the patients most of the time because patients don't want us to, and it's their medical record. So if they want us to, we will always discuss with them, but we don't do it as a requirement. And then a lot of people we were certifying, however, they weren't getting their cards. And that's mostly because it's not an easy process. If you guys have been through it, 2 proof of residencies, fingerprinting, and then you gotta get the picture. It has to be a picture on a white background with your eyes open with no cap. So there's a lot of things. You can't be a fireman, a police officer, and get your card. You can't have a CDL license to drive a big truck. So we have processors that just make sure all of the ducks are in a row so that when you get that sent out, it's sent out properly. Even when we do it perfectly, we're finding IDPH sometimes misses things and we have to resend things. That's okay. It happens 1% to 2% of the time. You'll get a deficiency, not a rejection. And then of course the physician certification is sent by us. But we brought this all in-house, so you get it done in one day. The whole operations take about 1.5 to 2 hours to see the doctor, fingerprinted, processed, but it's only one visit to Chicago, so it works well. And I can give you the data of success. We've certainly seen over 3,000 patients. We've certified about 12% of the entire state of Illinois. Patients seem to be happy. We use the outcome measures of Yelp and Google. We got 4.5 and 4.8, and that's pretty good for healthcare. But a lot of people, if you look at healthcare, it's not that high. And there's always going to be unhappy patients, and sometimes they didn't tell us about the felony, and we asked. So it happens. So we can't make everyone happy, but for the most part, people are pretty happy with what we do. I just want to share our numbers because we started this a few years ago. I started keeping data on January 18th or January of 2016, and it stabilized for a while, and we're up to around 200 patients a month of certification. And I think we only see patients in our office for certification 4 to 5 times a month. So because you have to get the processors, you have to get the fingerprinters, you have to get the doctor. It's a different process. But 200 patients is pretty high, and I think we're doing it efficiently. And we hope that number grows with the disease processes open up, like chronic pain and things like that. So we'll see what happens. The other thing I say is, even though we only see people once a week, you're able to get an appointment within 7 days, guaranteed. So we will get you in, we will make it happen, we'll stay longer. This is your medication. We need to give it to you and do it efficiently. So we really believe in that. Unfortunately, it's taken the IDPH and the state 3 months to get your card. We timestamp, and it's literally 87 days to 93 days, and they're overworked. And despite the law, in the law saying 30 days is a requirement, no one has really challenged that legally. It's just they're overworked, and I really feel like the current administration doesn't want to push the cannabis. They're not giving the funding it needs for the education that was put in the bill for the doctors. The doctors haven't gotten enough education on cannabis and don't understand it. So unfortunately, it's working against them. But I think the citizens and the people of Cook County, 67% of them came out support full legalization. So you're looking at the patients and the citizens versus the politicians. And up in this new election, the Republican opposition does believe in medical cannabis. The Democrats, both believe in cannabis and legalization. So I think things are going to change despite who gets elected. So hopefully, we'll see. Other statistics, we've weaned about 30 people off opiates. We've weaned over 40 to 50 off of benzos, but over 100 patients we've decreased these medications. And I'm not solely sold that we have to take everyone off of opiates. So that's not the idea. The idea is to improve their quality of life. And I want to harp on quality of life a little bit, because ultimately, getting on opiates or getting on cannabis is to improve your quality of life. And some people who've had multiple back surgeries, neck surgeries, they won't be able to come off of opiates and be content and be happy. And that's okay. We have to get them so where they reduce the amount of opiates, at least, so they can function better and not have the side effects. And if we can use cannabis to do this, we're really significantly changing their lives. So a couple thoughts before I leave you. And again, I'll be up on the speaker panel to talk about, to answer more questions. But, the science behind cannabis, there is some there. There is no question. The endocannabinoid system is there. We're still learning a lot about it. But I really believe that if you see patients or people who are using cannabis 2 to 3 times a week or every day, they're not addicted, but they are fighting some kind of pain, be it chronic pain, physical, or PTSD, emotional type of pain. I really believe that. And the real question for me is, okay, we'll get them certified so they can get cannabis that helps, but what is the underlying cause of that? Is there trauma in their childhood that, they're not, maybe they need more therapy, maybe they need more mindfulness, maybe they need some cannabis at times where their mind races. But I truly feel that people are self-treating themselves when they're using cannabis on a weekly basis. I definitely think it improves quality of life for any chronic illness. And then people ask, well, how does it really work? How does it work for, spinal cord disease and rheumatoid arthritis and fibromyalgia? Like, why is this the panacea? Why is it the cure-all? And I think, not going scientific, not going to the endocannabinoid system, not thinking about cannabis and the endorphins. And I think all of that is true. We're still studying it. But in truth, it somehow reduces anxiety. And anxiety is part of all these chronic illnesses, from rheumatoid to fibromyalgia to spinal cord disease. The fear and anxiety that occurs with getting pain, or you're going to get pain when the pill runs out, every 4 hours, every 6 hours, that is an interesting phenomenon. And cannabis definitely decreases anxiety somehow. And that's why I think it helps with so many of these debilitating and chronic conditions. It's that reduction of anxiety, which is so much part of the pain cycle and syndrome. And then, people ask me, well, why don't we study it? Then fine, you should study it. You're certifying so many patients. It's hard. It's just, when I did funded study by the NIH at Northwestern, it was funded by the government. I got $800,000 to get research assistants and get patients to come into my studies and study them. There's no funding right now for cannabis. And if there is, it's couple $1,000s, and you can't study a good study with 100 people in each arms, getting double-blinded controlled studies. We could do that, but it would cost about $1 million, which the pharmaceuticals would be happy to pay with if they could profit in some way, but they can't. The patent is held by the government. It is a Schedule I medication by the government, so the government can't even give money to research it. So how are we going to research it, right? And small studies have been done in other countries, but you realize the United States is the leader in research, and we're not unable to research it because of the way things are set up. So that obviously needs to change. Cannabis is a tool. It's, in my opinion, it's a first-line treatment in many things, though it's definitely a second-line treatment. It's so much better than any Xanax, long-term chronic pain medication. It can help with opiates. Seizure disorders with high-dose CBD cannabis certainly helps decrease seizures. We've seen that. In seizure disorders in particular, you do not have to get patients off of their seizure medications. But if you can reduce it so they can enjoy their life, if they can learn better, if they can pay attention in class, and you can reduce their seizures, it's an amazing medication. I think a new drug that's been FDA approved, which is a CBD, synthetic CBD, is going to hit the market and going to really open the eyes of people to get cannabis legalized. That's the hope. For nausea, there's no question. Cannabis is better than Marinol, which is a synthetic THC, and chronic pain, fibromyalgia. We've seen benefits with cannabis. So, first and foremost, for those that aren't certified, that are looking to get certified, this is our website. It answers all the questions on cannabis. We take insurance. One visit in our Chicago office, our only location, then one Skype-like telemedicine visit. And then, and here's where we're very different. If you need help getting your strains, we have someone, Farah and myself, who call the dispensary for you, see what strains they have. Every dispensary has different strains. There's 15, 16 growers. They're very good strains, but they're all different. So I can't say, go and get this strain. If you're in one dispensary, it might not be there in another. So we'll call and find out what type of RSO they have, what type of cannabis they have, indica, sativa, what kind, and then look at you and ask you, what kind have you tried? What has helped you? You've been to Colorado. What have you used that helped you? And then find something similar, because all the dispensaries have good medical product. So we just have to find the one that's right for you, and then we'll follow you every couple weeks to say, how did you do? How did your pain go? Didn't work? Let's get you a different one. And we do this all through telemedicine, so you don't have to come in. We use insurance for this because we're talking about your condition. And then, of course, it's a one-stop shop for everything here. So with that, I'll end it here. And please email me any questions that you might have. It's R and then my last name, Khare, at innovativeexpresscare.com, or find me afterwards, or come to our booth, which is in there, and we have my cards as well. So thank you guys for your time.